Hello everyone, so let us study today about intrahepatic cholestasis of pregnancy. So mainly it occurs in second and third trimester. This is mainly because of elevated level of bile acids in the body. So the patient presents with pruritus. Pruritus mostly seen in the palms and sole, and there is no obvious skin lesions. If more, there can be skin excoriation because of itching and pruritus. So how do you diagnose? It is mainly because of increase in the bile acids. What happens is, because of this increased estrogen and progesterone, this will alters the transport of the bile. Okay, so that causes bile to get accumulated within the biliary canaliculus and impairs its excretion. So there is problem with the transport, there is problem with the excretion, or there can be some mutations like ABCB4 mutation, ABCB11 mutation, or ATP8B1 mutation. So, or if you ask the history, there can be anything like family history of cholestasis, family history of any gallbladder stone removal, or liver dysfunction. All this factor will be there. Some of the studies even told even the winter there is increased risk for intrahepatic cholestasis of pregnancy. So, or there is any liver problem where there is reduced expression of the biliary bile acid transporters or receptors. So all this leads to accumulation of the bile acids. So what happens if there is increased bile acids? Increased bile acids, it impedes the but it is not available for its action. So this will reduces the absorption of fat soluble vitamin. What are the fat soluble vitamins? A, D, E, K. Okay, so this K is affected, so therefore clotting factor is affected. What are the vitamin K dependent clotting factors? 2, 7, 9 and then 10. So when this clotting factor is affected, clot will not happen. There is aggravated risk for DIC. Okay, and because of this stasis, there is increased risk for gallstone. So mother had increased risk of gallstone, increased risk of DIC. So this stored bile acids, this going to irritate the uterus. When it got irritates, so there is preterm labor. Preterm is by 40 to 60% patients. Okay, then this will stimulates the fetal gut. When it stimulates the fetal gut, you get meconium aspiration syndrome. Okay, even it will stimulates the fetal heart. So that causes the toxic effect. Because of this toxic effect, what you get is arrhythmia. So there is chance of arrhythmia, meconium aspiration, preterm labor, and if the bile acid level increases by 100 micromole per liter, there is higher chance of stillbirth. So this is in brief about intrahepatic cholestasis of pregnancy. Hear me, Dr. TSR. Thank you.